Well, hello everyone, and thank you for joining us today for the July meeting of Health Infonet's Behavioral Health Information Technology Reimbursement Initiative. I am Gemma, as you know, and I am the chairperson for today's call. Before we get started, just wanting to remind everyone that everyone is muted, and that's to ensure good sound quality. So that's a *7 to unmute and a *6 to mute. Sharon Greenleaf, I don't know if you have joined us yet, but if you are here when it's time for you to share, please do a *7 to unmute, and we'll be able to hear you. As you all know, we are able to do questions and answers using the chat feature. And so you can go ahead and do that. For today's meeting, we have a lot of folks that are joining us today. I'm really appreciative for all the stories that all of you have been sharing with us. And a number of the people on today's call we haven't heard from yet. And I thought it was really important to hear some of these great stories coming from these different organizations today. One of the things that all of you have in common, and it's really driving the quality project, which I'll talk about in a couple of minutes, is that you are doing a great job, and it's really new to be doing this, and that's integrating behavioral health care and medical care. And that's really new, and we're doing it here in Maine because of you all. So thank you, and all of our guests today are going to be talking about how they actually are doing that in their organizations. So the first thing we're going to do is I'm going to kick off with just a very brief overview of where we currently stand. We are making progress here. We do have another organization is sending us data live, and that's Motivational Services. Thank you. Call out to all 14 that are on this list. The good news is that for our other remaining 6 organizations, we are able to, I'm just going to go up here. I'm jumping ahead. Never mind me, I'm going to go back. I wanted to say that for the remaining organizations, and I'll talk more about that in a couple of minutes, for the remaining organizations, we do have an extension on the SIM grant that has been given to all of us. Katie did talk about that in our last webinar in May. What that means is that we are going to be able to have an additional year to get our other 6 organizations to these important milestones and payments that really you all deserve. So I'll talk more about that in a couple of minutes. I want you to take a look at this number. This is really impressive given the fact that so many staff are going on vacation at this time of year. And your actual June lookups between all of you has increased. And this is despite vacations and time off that a lot of people have had. A number of our organizations have increased significantly their usage, and you can see them listed here: Cornerstone, Restorative, Sweetser, Opportunity Alliance, Tri-County, Well Done. We do have high-performing organizations. As always, we see Assistance Plus, Catholic Charities, Community Health, NOE, OHI, UCP, Wings showing up. So well done for continuing the good work. And I saw this number, my eyes fell out of my head practically. I know that's a bad image, but Jason White, hello, I don't know if you're on the line, but look at what you guys did. You went in May from 297, which was already twice what you had the month before, up to 439 lookups.
Hello? Hello?
Yeah, I've lost her too.
Okay. Just wondered if it
hi.
should be.
Hello?
Are you there, Gemma?
Yes, hi.
We lost you.
Okay, I'm going to, oh my goodness, let me go back. So you've lost me from the very beginning, haven't you?
No, it was
Just a
it
few
was
minutes.
after the lookups.
Okay, got you. There must have been something happened. Okay, thank you for speaking up. Technically, I am not the technical person at Health InfoNet. I think you all have figured that out by now. Thank you so much for speaking up. So at the lookups, we can just see that well done is really what I was saying is how great you all are. I'm sorry that you didn't hear me saying how fabulous you are, but you have done a great job. Every time you are doing this, you're actually the connector that is bringing together medical care and behavioral health care. So these numbers are something that all of you share, so thank you for that. This report that I prepared for you guys, what I was just saying, is that I worked really hard to try to make this really easy for you, so please don't sweat on this. I'm just looking for you to put X's where it's indicated. And what we're really looking at is just how your staff uses the different interventions that you do. We're not asking you, and this is one of the questions that came through, do I need to put an X at each intervention? And the answer is no. The interventions that we listed there, the interventions that all of you are doing, some of you are doing 3 of them, some of you are doing 5 of them, you're all doing different ones. I'm not interested in you all doing the same thing. You're different organizations, and that's not the intention. The intention is for us to identify how different roles that the different staff members in your organization have, how different roles use Health InfoNet. That's all. And it's an educational piece because as we continue to onboard other behavioral health organizations, they wonder how does a case management use Health InfoNet? How does anyone have access to Health InfoNet if you're not a doctor, if you're not a nurse? And this gives us an opportunity to be able to use your examples and to say this is how our behavioral health organizations, case managers, go in and use it. It gives us that piece. The other thing is as we're completing the quality project and we're going to be looking at writing it up, I want to be as clear as possible with the different things that you all do. I'll be drilling down more, and I may be calling on you and asking you some follow-up questions. So I know we'll be in touch about just details as we move forward. Another question that has come up is, when does this grant end? Isn't this supposed to end now? And I'm not sure if you heard me talk about the no-cost extension. I don't know when my sound cut off. But we have received a no-cost extension for the SIM grant, and why that's really good is that we do have 6 organizations that we have not been able to, because of some real challenges with different EHR vendors, things along those lines. It's so big, rolling out IT, it's so hard, and there's delays and things that we can't pull off. So we do have another year to be able to do that and be able to meet milestones for other organizations that haven't been able to do that. So that's really good. We did talk a little bit about that. This is from a slide that Katie presented during the May webinar, which I'm just putting it in here for your easy reference, and that we are committed to work with all of our organizations to meet all of those milestones. Another question is about the quality project, which has been such a large part of our work together. Really glad to say that at least with the initial look at, and it's too early for us to run real numbers because we're just finishing the data collection now, but it does look like there has been significant reduction of ED usage between the two parts of the 6-month period before we had the test environment going and the 6 months during the quality project test that we were running together. It's being noticed, I will tell you, from DHHS and they know all of you are involved. They are very appreciative. They see your names, and they're going to be seeing our numbers. And so more to come on that. It's very, very exciting. I'm very excited to be able to share the story, and I must admit somewhat that I brag about you. I hope that's okay with you, that I do brag about you to anybody I meet, at any meetings that I see about what a great job you're doing, and they hear some of the stories and they're just shaking their heads and thinking how great it is. So you guys are integrating medical and behavioral health. This is so new, and it's very exciting. Okay. We are going into subscription mode with Health InfoNet with behavioral health providers. Katie did talk about this during the May webinar. In case any of you missed it or you wanted to have that information for easy reference, I've included those slides that she presented on in May at the end of this particular slide deck. So that's available for you. So with that said, Sharon, I don't know, with all of the confusion early on and with me going mute, Sharon, was that you on the call?
Yes, that was me.
You are so strong. I love it, barreling through my silence. Thank you so much. I think actually this is a great example of why NOE is so successful. Sharon she doesn't let go. She just goes after something and with tenacity, and I mean that in the best of things. And today I asked Sharon to talk with us a little bit about NOE because they have been so consistent from the very beginning in usage. Rolling out health information technology in any environment is very, very difficult. But NOE was an early adopter, really the first among all of our organizations, with the exception of maybe one or two, to adopt health information exchange and to do it really with so many people almost immediately. And so many users log on consistently, every month. And Sharon had shared with me the secret to her success. And I know that really one of it is because of Sharon. She's a champion. And I know from my previous work with helping primary care doctors use EHRs in their practices that one of the best practices for HIT adoption, and there's a lot of research behind this, but that is that you have to have a champion in your organization to do that. And at NOE, the champion really is Sharon, and she really does give all of us an opportunity to think of how we can be champions ourselves, because the people that are on this call is leadership, the behavioral health organizations. And when you can lead from the top down, that's when the change really happens. So with that, Sharon, you told me that it was supervision that you used, and I was so interested in that because I know supervision is throughout all of behavioral health organizations. It's really the platform for how we are able to do good clinical care with our clients and be on board also with what's needed at the behavioral health organization level. So Sharon, with that, I want to just hand it over to you, and can you talk to us a little bit about how you use supervision as that platform to drive good client care?
Hello?
Yes, I can hear you.
Oh, okay. Sure. I have a very big stick, Gemma. That's no. You've really talked. You make me sound quite wonderful. But supervision, yes. Every meeting we talk about HIN and how we can use it, and we really talk a lot about, because initially, especially clinicians, the LCSWs, LCPCs, and so forth, were really unsure about how they could use HIN to help them in their counseling. And so, we talked a lot about the mind-body connection, that we're not separate. We're trying to really make sure that we look at the whole person and not not just pieces. So that helped a bit. And then the nuts and bolts of how to use the HIN were things like, if people are looking at the medication list, clarify what the person is actually being treated for with their PCP. Talking to the clients about how to best use that information. Sometimes they may be very anxious about this information and don't really have a good understanding. So just helping them use their relaxation and talk through the various tests or things that the doctor is telling them about so they have a better understanding. And then using that to help them, use that for motivation to help them understand how taking good care of their physical health is going to help their mental health as well. So just a lot of the practical things that we used in supervision, talking about different cases and how having the most up-to-date information could help, and how to use, if somebody were not, say, for instance, taking their sugar levels and how that could affect their mental health. So I don't know. We just use it. We love it. I think everybody here has had a different use of it, and we've used it as, when people go to the emergency department. Oh, that's another thing. Maybe they went into crisis after they saw their counselor, and so now they've gone to the ED. When they come out, we can then take that information and make maybe a better crisis plan, or talk to them more about what to bring up in their session if they leave here and they feel like they have to go to the emergency room. I don't mean right on the heels of leaving here, but in the next day or two, instead of calling us or that, so we can make a better crisis plan in that kind of situation. Having the information immediately has really been helpful. Sometimes people misinterpret what they were told by their PCP, so we can go in there and look at what was actually said or what was actually called for and help people to understand it, both from the clinician point of view and the BHH or the case manager or the CIS worker, if we have that. So it's really, we use it all the time. I think initially people were afraid to use it because they were afraid at the very beginning, well, maybe I'll delete something that's important, or I'll get in the wrong place or that. But we demonstrated how we couldn't do that, and we use it. Every supervision we talk about it, using it. So that's all I can say.
Yeah, thank you. I think what really has struck me, just even that last sentence, during every supervision, I talk about it, and you really have illustrated for us today, thank you, how when you are looking at the whole person in front of you, meaning then you're not only looking at the clients that your behavioral health staff see, but you're also talking about the behavioral health staff themselves, recognizing their need to have their fears alleviated about using technology, and you address that directly. But also the sense of competency that the staff has when they have the information that they need to help their clients.
Right.
And that's important too. So thank you, Sharon. Really appreciate it. And if anyone has any questions for Sharon, we'll be taking questions at the end. Thank you, Sharon.
Okay, thanks.
So next, we're going to talk to Shelley Gagne about how Charlotte White uses Health InfoNet to integrate medical and behavioral health care. So, Shelley, if you can do that *7 to unmute yourself.
Hi, Gemma.
Thank you,
I'm
Shelley.
here. Hi, everybody.
Thank you. When we talked, you did say that one of your experiences was how different it was depending on which office you were from, that in the Bangor office you had better experiences of the data in Health InfoNet than when you're up in Dover Foxcroft. Can you talk a little bit about that?
Sure. Yeah, one of the things that we've, been tracking is the ED visits and everything. And what we've come to find out is hospitals up here in the Dover area, will document that they went to the emergency department, but we don't see the notes from it. Whereas in Bangor, Eastern Maine, St. Joe's, we can actually get access to the notes pretty quickly. So there definitely has been a change in providers that use it in different locations.
Yeah, and I wanted to take that opportunity to just tell everyone, and I think a lot of people on the call have had that experience too, and we are limited by what an organization sends us. If they don't send us information, it's not in the information, isn't in the HIE. You do sort of get an experience of how good it is when the information's there, so you really do miss the information when it's not there. The good news is that up in the Dover area, Mayo will be sending us data very soon, so that's changing. Things are we're going to be getting more information from more people, so hopefully that will be a better experience. You'll have the Bangor experience everywhere. I hope that happens sooner than later. But I did want to say that that's something that I know a lot of people on the call have experienced. So I did want you to talk about that a little bit because when you're coordinating care and you have experience of how it makes a difference for you and saves you time and makes such a difference, you really do miss it when it's not there. So, but in the Bangor area, it has been available to you, so you have been able to experience some different outcomes. So why don't you talk a little bit about the things that have worked for you?
Well, as you can see on the slide there, the radiology piece, I can't say enough about, even though, the ED notes may not be in there, there is radiology. Anytime anybody goes to have an X-ray or a CAT scan or an MRI, we have very quick access to that. And it has been beneficial to support our clients. We did have a couple, I spoke with Gemma about one instance about a person who had broken their arm. And when they went back for a revisit, they had x-rays again, and it showed up that the person had re-injured the arm, but was in, denial about that there was ever any instances that had happened. And then after being able to coordinate with the team, the doctor and the case manager, and the client, they were able to find out that she had fallen against the door frame and remembered that she had surgery on it and had pins in it, and then this actually re-injured it. So the team process has definitely been very important to be able to ensure that the client can understand what the doctors are saying too. So that's been important. And you also talked about you're not a nurse, but you are still able to go into Health InfoNet. I think that this is a really important piece to bring to the table, Shelley, because a lot of behavioral health providers don't go into Health InfoNet because they're not a nurse. So can you talk to us a little bit about how it has helped you with your quality work? Sure. One thing I do really like about Health InfoNet is the way it's set up. Lab reports are all in one area, radiology in another, and et cetera, office visit notes. And especially with the lab reports, we do have from time to time different people say, so-and-so had a lab report done, are you able to access what their reports are? And the way it's labeled, I can tell by the color coding system that they have. If it's in black, that pretty much everything is normal. If it's yellow, it's elevated, and red, it's something that's out of the norm. So, like I said, as me, I'm not a nurse, so for me to open up a lab report, I'm not able to look at it, but I can look at the color coding system and tell the difference. And then we can also take it to our nurse to be able to read the results and be able to share that with the person. One of the instances that we talked about was that we had a person who went to the psychiatrist and reported that she was in kidney failure, and she knew she had just had blood work done. And so we were able to, and the primary care had the blood work done just to check it. And we found out that no, she was not in kidney failure. And so it was just a misinterpretation. And so with finding out this team approach, again, we were able to ensure the person that she was not, in kidney failure.
And that was really an important piece to bring down her anxiety and have best outcomes for her. I think these are just some really good examples on how everyone can go into and use what is seen as a medical tool, but that there's ways to kind of humanize the data. So thank you so much for sharing that with us, Shelley. And talking about humanizing the data, I wanted to introduce you to our next speaker, Shelley Thibodeau at Assistance Plus. Shelley, you talk about humanizing the data when we were talking, and I would like you to share today some of your experiences with Health InfoNet, because as you've talked to me about it and the way that you have worked with your team, it's some stories I'd like our other organizations to hear this morning.
Sure. Hello, everyone. Thank you for having me. I find the Health InfoNet fantastic. It gives me a great approach to read history. I always, before any patient visit, I always read the history. I look at the last lab work that's been done. Going along with what Shelley Gagne had talked about, we can really see the discharge summaries and what the docs are thinking versus really what some of our clients hear. And so it's an easy way to clarify what's been talked about. As the BHHO nurse, we have a responsibility to make sure that lipids are up to date, A1Cs, depending on the diagnosis of each client. So I have the dates right in front of me. And when the procedure was done last, as far as drawing the labs. And if some of our clients are reporting pain or other things happening in their body, it's a great way for me to put together, by looking at the numbers, where the client is at internally. So it really helps with management of chronic symptoms and quicker turnaround for acute symptoms in keeping people healthy.
Yeah, and you were also talking to me about, well, when you're talking about right now, humanizing the data, you see those numbers and you see the pain they're in. And I was really struck by that when you said that. And And then you followed that up with the fact that you want people to honor their bodies the way that you respect them too. You want them to step off the plate, up to the plate, so to speak, with taking care of themselves. And can you talk a little bit about how you use Health InfoNet to support that client education that's so important to the work that you do?
Sure, absolutely. A big number I always look for, a lot of our clients have fibromyalgia or, some sort of pain in their body. And so the C-reactive protein is a great tool. It tells actually how much inflammation is happening in the body. And so I use that a lot in educating the clients that we work with, and preventative health too, as far as maybe modifying the diet to reduce the amount of inflammation in the body. So the humanizing it brings it right to them, and it allows them to have a voice as well in their own care, in their own health.
Another thing that I really hadn't heard anyone else say before speaking with you was that you really look into Health InfoNet to sort of know what's going on, to sort of drive into what the provider is thinking, what the doctor is thinking, and you can somewhat see what the patient is thinking by like the meds that are filled, if they're med seeking and something along those lines. Can you talk a little bit about how Health InfoNet helps you to connect the dots as a provider when you often don't know enough about a client, but then you go into Health InfoNet and it gives you more information?
Sure. In reading some of the narratives on the outpatient visits with providers, they typically will have a plan. So they assess the patient, they diagnose and come up with a plan, and then it's up to us on this end to follow through the interventions and evaluations to make sure that it's been effective and evaluate whether it has been or not. So this really helps with gathering correct data, because as we talked about earlier, not all patients understand exactly what the doctor is saying. They are often intimidated and they're anxious anyhow, maybe because of bad prior experiences or for whatever reason. So this helps me go through and I read what the doc writes and see what the plan is, and then reiterate it with the client. And it helps for better success for their own health. And as I had said before, it allows a pragmatic approach. The numbers, if somebody's eating donuts all day long and they say, gee, my blood sugar's been great, and they have an A1C drawn and they're up in the 10 to 12 numbers, then you really can't argue with the numbers. So it's taking that information and developing a realistic plan, and you just can't argue with the numbers.
Yeah, I love it that you say that, and it also gives control back to them because you're sharing with them. It's not like you're the authority and you know what's going on. You're sharing that information with them, and it allows them to take ownership, which is something you're very keen on. Another thing that I really like about what you do there at Assistance Plus is how you work with the case managers there, that you are down the hall from them and you go and you actually meet them in the hallway anywhere you are, and you take a meeting and you ask them, how are your people, what's new? Can you talk a little bit about your work with the case managers and how you are teaching your staff to integrate the medical and behavioral health data together?
Absolutely. Our staff here is great, and I try to go out. They have a fairly good-sized room that they go in and document, and so my office is off the way a little bit. So in my past experience, bringing people together and collaborating in the different disciplines, be it the nurse, case manager, BHPs, knowing what they see with their client and just kind of giving a little bit of information, it's so much easier just to touch base, share information, and it's been easy in the past. The case manager will report something that has gone on, and for me on the medical side, I can help explain a little bit, maybe if they've had a medication added. So I try to touch base with the case managers, and I explain to them, okay, so this medication's been added. This is what to look for any side effects. If you notice anything, these are the important ones. And it kind of brings everyone together. And they have a big job. And the support of the nurse maintaining or taking care of the medical aspect, the feedback I've gotten has been pretty positive. It's one less thing they have to worry about.
Well, I think, thank you so much for sharing that with us today, Shelley. I think it's so key. A lot of the behavioral health homes that are on the line, everybody has to have a nurse, and what a great addition it is to the staff, especially when there is this kind of teaching component with the non-nursing staff. So thank you for speaking to that today. And Assistance Plus has been doing such a great job consistently with using Health InfoNet to integrate care. So thank you to the whole staff too. Thank you. Moving on to Pathways. And we have Stephanie Ween to talk about something really unique that Pathways is doing, and that is coming up with their own IT solution to share data and meet the reporting needs of their clinical staff. So, Stephanie, I'm going to hand that over to you to talk to us a little bit about that.
Wonderful. Thanks, Gemma. So we at Pathways have been developing our own individualized EHR for the last 7 years, and it's something that we decided to embark on when folks were signing up with a lot of bigger companies or EHRs that had already been developed. And so because we have done that, we have the ability to tailor our system to all of our own clinical paperwork as well as our individual staff needs. And we've come quite a long ways in that time, and we here in Maine for our company overall are leaders in that technology and how we've developed that system and how we use it, not just clinically, but also how we use it for our individualized folks to be able to put all of their data and information in one place and also be able to share and access all of our clients' information. So we've been really excited to be able to work with Health InfoNet and be able to share from our electronic medical health record system into Health InfoNet's system. And one of the cool things that we have really been able to do is also be able to share some of that technology back and forth to share additional information outside of just the contact summaries or the visits that we have with our clients and expand that to some of the clinical information. So we are in the testing phases right now to be able to share parts of our clinical assessments, our treatment plans, those 90-day reviews, and then the discharge summaries into Health InfoNet. And what that will allow is for folks that are on the medical side of things to really read that clinical information and understand what goals and objectives we're working on, and what progress is being made with each of our clients, and have a better whole picture on how we're treating through our home-based care, and then what that looks like on the medical side, how we can also collaborate and treat through medical care, so that we're a lot of times treating the same issues, and we can use a more collaborative approach to make sure that we're seeing greater success with some of those challenges that folks are experiencing. So our goal to have all of this information shared in is for October 1st, and we're in the testing phases of that. We currently send, much like all of you, all of our client progress note on the demographic information and when those visits are occurring, but we haven't yet started sharing that clinical information, and we're pretty excited to be able to do that.
Well, thank you so much for giving us a little bit of a taste of what's happening on the platform that you are working off of. And the platform's important, or else Lena wouldn't be able to do what she does on the clinical end, which is at Pathways to help integrate the behavioral health and medical health care. So, Lena, can you talk a little bit about how you are able to leverage all the work that has been done for you from Stephanie and her team to help integrate behavioral health and medical care?
Sure. So, like many of you, we've been promoting the integrated approach of behavioral and physical health care in all of our services. But we really found that Health InfoNet has been a fantastic tool to enhance this integrated approach for our care coordinators. And so for this project, we've had our care coordinators and supervisors using the site. And our care coordinators, they provide targeted case management for children and community integration services for adults, as well as behavioral health home services for both. And one of the immediate benefits they found with Health InfoNet is in their development of comprehensive assessments. In the past, they would just pretty much rely on client or family report of the medical information. They would, certainly with the mental health piece, when clients would report history of like psychiatric hospitalization or other specialized services, we would go and access those reports to really get a full picture of the mental health. But when it came to medical information, we connect with their primary care physicians, but we wouldn't even think to access ER reports or other specialized medical providers. And so Health InfoNet just opened this world, this wealth of information on the physical health care of clients. And so that really helped care coordinators see the full picture and really be able to respond in a more integrated manner. And so that was just immediately a benefit that was experienced. And another benefit that the care coordinators experienced was in crisis planning. Once again, the history was really mental health, really heavy on mental health. We definitely would think about the symptoms that contributed to, their experience of crisis. But with Health InfoNet and the integration of the medical piece, we were able to develop some the emergency plans that included both physical symptoms, physical health, as well as mental health. And that showed up in our, we did some emergency department prevention plans. And so these were all connected, and that really helped both preventative care and responding to the care of clients. And it certainly changed how the care coordinators were able to support clients and families as they're following through with their needs, both medical and behavioral health. And so, Health InfoNet, it really provided a map or a great history of the client's symptoms and diagnosis and treatment, and it enabled our care coordinators to be able to connect the mental health symptoms with the physical symptoms and really truly understand how they're related. And, just seeing this, just accessing that information on Health InfoNet just provided that snapshot and provided this information. And so they had a much better understanding on how to support clients in responding to these symptoms, and also to know what resources to access. So, in a bit, I'm going to provide an example of one particular client that, someone who experiences intense pain. That pain, although it's real for them, it might not be attributed to a medical issue, and so they may require a mental health intervention to fully resolve it. And vice versa, certainly a medical issue contributes to an increase in the mental health symptoms. And so that approach is really necessary, that integrated approach. And so, that really helps the care coordinators be able to bring that integrated approach, bring that lens to both emergency situations as well as preventative care and serving clients. So, we are here to, we've seen really how the connection of physical and behavioral health care is played out in so many of our clients. And this one in particular, a 15-year-old teen with PTSD and very heightened anxiety, who has a parent who's also very anxious. And so her anxiety and reactivity really led her to, she used the emergency room 19 times last year. And while, a few of these were triggered by, escalated mental health symptoms and, crisis services wanted to do a psychiatric evaluation at the ER, most of these were kind of her experience of physical pain that were very real to her. And, with her mental health issues, she experienced this as a medical crisis, an immediate medical emergency that she would, express, and then her parent would also be heightened, very anxious, and get her right to the emergency room to treat this medical emergency. And obviously once they got there, they really found out that a lot of these symptoms did not have a medical basis, and they were not medical emergencies. And so this really showed how, it, gave the care coordinators this information. And so that they were able to develop an integrated approach to support this family and to respond to this youth and this parent. And so that approach, if you go to the next slide, that approach looked like this. First it started out with the care coordinator, also had the family start up with intensive mental health services, so our HCT program. So it was more than, she had outpatient counseling in the past, but really needed some more intensive home-based work. So the care coordinator and the clinician provided lots of psychoeducation around the relationship between, this kiddo's mental health symptoms and their experience or her experience of pain. And so they really showed, mapped out how her anxiety contributed to her physical pain, and then because of her, emotional heightened anxiety, then she tended to experience it as a medical crisis. She would catastrophize. That definitely symptoms of PTSD would play in here, and then this would then exacerbate other mental health issues, like a sense of hopelessness and rage. So not only, dealing with anxiety and PTSD, but then you get these symptoms of depression that come into play. So, once the family started to really understand that, and we were able to reinforce, a mental health response to a physical condition that the kiddo experienced. And so through, they developed a plan that, when this youth does experience pain, They do connect to the HCT clinician who's on call, really supports the kiddo with those strategies to reduce those PTSD symptoms. And then, they've really been able to avoid this escalating to a medical emergency. And she's been able to just, slow down enough to then access the primary care physician to ensure that this isn't a medical emergency. Yes, you are experiencing this physical symptom, and you have your mental health, but it can definitely turn into a much more appropriate approach to what she needs and appropriate care. So definitely, when we look at the numbers, this approach did prove successful. This youth now has only really had 3 unnecessary ED visits this whole year so far, and as opposed to the 19 last year. So definitely, this had made a difference, and utilizing Health InfoNet provided that immediate information to reinforce that this approach was the appropriate approach.
It gave you the information in real time so that you were able to do your interventions in a timely manner. Sometimes with this population, that can make a big difference as well. So well done.
Exactly.
I think it is a great story about the integration of mental health and medical health, and what a difference it can make when you get a good behavioral health team involved. And you see this one example, but when you replicate it across your entire client base, the numbers start to add up. And that's what's exciting about our quality project, and I'm looking forward to reporting all of that out to you in a few weeks as we get more information. So thank you so much for sharing that today. I did want to just let you know, these are Katie's slides that I mentioned. They're here for your review, having easy access to them instead of digging out through your emails to look at the May work. But this is the slides from there. Any questions from anyone today? I haven't seen anything come through chat, but if anybody has a question that you want to just pipe up and speak out, you can do a *7 and unmute yourself. You also know where I live. If you have any questions, to please get in touch with me. Katie is out on medical leave, and in her place, I am here to help you as much as I can. If you have any questions about the slides that Katie presented in May, I will try to get answers for you if I don't have them. So there's always someone here ready to help you. Please know that. Okay, I'm wanting to remind you that behavioral health clinical intervention by staff role report, just do X's, please don't stress about this, but please get that to me by the end of the month, and that we do have another July Quality Initiative audit report to come to us as well. So when you get that available, send that my way too. We are not going to have a meeting in August. July's bad enough for vacations. A lot of people are away, and good for everyone taking vacations. August is even worse for vacations, so it's just better for us not to have an August meeting. I am going to be on vacation for 1 week, but other than that, I am in the office, so if you have questions, again, please don't hesitate to reach me. You know where I am. Thank you, everyone, for joining us today, especially Sharon, Shelley, Stephanie, and Lena for sharing your stories, and all of you for being so patient with our technical glitches, and for all the work that you're doing. I am so excited about the work that you're doing. So thank you, everyone, and have a wonderful rest of the day. Thanks.